Hi everyone, my name is Morgan Hodges and I am a fieldwork student at the American Stroke Foundation from the University of Kansas Medical Center. This video is part 1 and includes information about fall prevention and an activity to practice identifying hazards in your home. Part 2 will include exercises to increase balance for you to do at home. So why do falls happen? Well, there are many reasons and multiple kinds of risk factors. I have categorized them here into 3 groups: the personal factors, environmental factors, and activity-based factors. So personal factors are things like the specific effects of your particular stroke, such as weakness on one side of your body, or maybe changes in your vision. Other personal factors include your attitude, your behaviors, your fatigue levels, and your abilities. Secondly, environmental factors are things such as hazards in your home that could increase your risk of falls, the type of shoes you are wearing, and the availability and use of your mobility device. Finally, activity-based factors are when the demands of the activity is greater than your ability. For example, someone who benefits from using a cane to walk around their home may choose intentionally or unintentionally to not use it. Because of that choice, walking to the bathroom without their cane could increase their risk for falling. This diagram explains what we sometimes call the cycle of falling. You'll notice at the top of your screen, you can see the cycle starts with you fall. Maybe after you fall, you could experience fear of pain or fear of falling again, which may lead you to reduce your activity, such as sitting on your couch more or asking others to get things for you. Because your daily activity is lower, you are then at an increased risk of falling again, which could lead to the second fall. So this diagram shows how it can be a continuous cycle. But the great news is that falls can be preventable. My hope is that through this presentation, you learn how to reduce your risk of falls by identifying hazards, making thoughtful choices, and increasing your balance and incorporating safe exercises into your daily routine. First, I am going to lead you through an activity. You will see 2 pictures on your screen that look very similar. It is your job to identify the difference and be able to explain why it is important for fall prevention. The activity may remind you of the Spot the Difference games. This activity will also help you to work on your visual scanning skills, which are important to utilize every day. I will show you the pictures first. After you have looked at it, share your thoughts with the family member or caregiver. You can also practice your writing or typing skills by jotting down your thoughts too. You can pause or rewind the video whenever you need. Once you have seen the picture, I will review each one. Check to see how many you get right. So I will walk you through this first example to give you a better understanding on how to complete the activity. This is bedroom number 1. You should see 2 pictures that look similar but are different. In each example, the one on the left is a space that has some hazards in it. The one on the right shows you how the space is much safer. It is going to be your job to identify what is different and why it matters. There are numbers in green circles that are helpful guides so that you can compare number 1 on the left to number 1 on the right. What is different? Well, there is less clutter on the table in the right picture. There is also a lamp which increases the amount of light in the room, which is important. Now compare number 2 on the left to number 2 on the right. What do you see that is different? Well, on the left, the rug is not secure to the ground and the shoes are in the walkway. On the right, the rug was removed and the shoes are placed in a safe spot to prevent tripping or falls. Now you try number 3 and 4 yourself. Pause the video as you need to take more time, or you can rewind to listen to the instructions again. Here you will see the same pictures with the answers. We have already talked about numbers 1 and 2. So let's go to number 3. Number 3 shows you the importance of having a phone within reach in your bedroom. This is helpful in case of an emergency or if you need to get in contact with someone. For number 4, you will see that they removed the furniture chair. This is because it was blocking the pathway to the door, which made it unsafe. It is important to keep a clear path towards your doors. So, how'd you do? Did you notice the differences? Were you able to identify the importance? It is your turn to do the next one by yourself. It's your turn again. This is the stairway. What do you notice that is different and why is it important? Let's talk about stairways. Did you notice the added handrail for number 1? Handrails are important to hold on to while moving up and down the stairs. Make sure yours is securely attached to the wall. The difference is for number 2 is that the stairway is clear of clutter. If you have items such as books or shoes on your stairs, you could accidentally trip on them. Keep your stairs clean. Lastly, number 3 shows the addition of a light switch. Extra light helps you to navigate your space better so that way you can see everything. Here's another bonus tip I have. If your stairs blend together, like this photo, you can add strips of painter's tape or another type that won't ruin the finishing to the edges of the stairs. This will help you identify where each step is. Make sure the tape is secure, and if it starts to come off, replace with new pieces. Now try to find the differences in the bathroom. Number 1 and 2 shows the importance of having grab bars as support during transfers. It also shows the addition of extra lighting to increase visibility. Number 3 shows that the bath mat on the left is loose and unsafe. Bath mats are important in order to soak up extra water and reduce slippery surfaces. Make sure yours is non-slip and secure to the ground. Number 4 is all about assistive devices. If you benefit from a shower chair or handheld shower head, be sure to use it. This final example is in the kitchen. Number 1 shows how it is important to keep your items organized and in easy to reach places. Now we've talked about number 2 a couple of times, so I hope you got that one right. Removing a rug or making sure it is very secure is extremely important. Finally, number 3 shows how you need to make sure that the floor is clear and you should move pet dishes or anything else on the ground away from your walkway. Keep items you use often in easy to reach places to increase independence. In the next few minutes, I'm going to go over extra quick tips. Wear shoes that are fitted properly for both feet, sturdy, low-heeled, and have rubber soles for traction. If you use a cane or are independently walking, having handrails on your steps outside is extremely helpful, and using them will reduce your risk of falls. If you use a wheelchair or walker, purchasing a sturdy and safe ramp will help you enter your home safely. Make sure your front porch lights work and use during nighttime. Similar to inside steps, keep them clear of clutter and identify edges of each step with bright tape if needed. Take your medication how your doctor prescribes. Get an organizer to help you manage your medication. Set alarms on your phone if you need reminders. Be aware of any side effects that may cause increased fatigue or dizziness. Stay in constant communication with your doctor about if the medicine you are taking is right for you. Schedule and attend regular eye exams. Seek help from your eye doctor if you notice any changes in your vision, and if you need glasses or contacts, make sure you wear them. A healthy lifestyle will decrease your risk for falls. Stay hydrated, practice healthy eating, maintain a regular sleep schedule, and stay active. Be aware of how changes in weight can change your center of gravity, which can increase risk of falls by altering your balance. Thanks for listening. You guys can watch part 2 of the video for balance exercises.